Today our lecture, the doctor-patient relations. I am Professor Alexander Dvirsky. Okay, today very interesting topic. Today we will discuss about negotiations between doctor and patients. Who is a doctor? Who is a patient? Doctor and patients. First, it's a personality. I something refresh your knowledge about what does mean personality. Personality is a favorite pattern of behavior, which same in same situations, which different in different situations, and which stable in every personality. It's mean in one situations you like a doctor, in other situations when situation changing and you have some medical problems, you are a patient. But I paid your attention. Doctor and patients, it's a personality. Personality, it's a behavior. I hope you remember. Yeah, it's a behavior, it's a stable pattern of behavior and thinking. In general, mental process, dependent personality. But personality in general, it's a behavior. Yes, of course, every side waits something from other side in these negotiations. Patients need a reduce of symptoms. Doctor waits some result from treatment. Yeah, yes, of course, doctor have some personality feature. It's influence to the treatment process. It influence to the doctor-patient's relations. Doctor wait some effect from treatment. Why? Because doctor have something like a self-esteem feeling. Yes, something like this. Doctor has like this feature. Okay, now you understand. Yeah, communications very important part of treatment, because very often first stage in our differential diagnostic process, it's a communications with patients. Due communications with patients, we receive information about patients, we receive information about symptoms, and very important stage in these situations, it's very important stage, it's therapeutical compliance or adherence. It's like how patients satisfy doctor recommendations. If patient trusts the doctor, he satisfies recommendations. He has more higher level of the compliance. Next effect which present in doctor-patient's effect, it's a placebo effect. What does mean placebo effect? It's improved symptoms without evidence-based medicine treatment. It's mean treatment absent but effect present. Why it's present? Because patient trusts to this effect. Patient after consultations must feel something positive. It's very important, because what aspect of the consultations? In consultations, patients usually feel distress. In consultations, patients feel worry feelings. In consultations, patients has a fear feelings. And yes, of course, it's influence to his cognitive ability. It's influence to the style of negotiations. It's maybe developing some problems like anxiety. It's maybe some problems like decrease some cognitions, problems is inattention, and it's be influenced to the result of consultations. It influences to the informations which patients provide to the doctor, and as a result, patients must relax during consultations, because when he relaxes during consultations, it means that he trusts to doctor, he trusts to positive future. It's very, very important. Doctor-patient relations, my opinion, it's a core of the practical medicine, because usual in usual medicine. I don't speak about high technology medicine in which doctors sit down on the computer in the other country and reading MRI and reading imaging. In majority situations, doctor and patient has interpersonal contact, and very often, for example, patients want interpersonal contact. I mean contact in like a face by face. It's very important. It's very important for patients. It's why? Because I refresh once more. It's a doctor and patients. It's a personality. Personality. It's a people. It's a human. And yes, of course, humanity. It's a very important part of our word, our personality. Communications with patients. It's part of the therapeutical process. If patients and doctor has good communications, it's improve therapeutical process. It's do therapeutical process more brief, more understandable, more easy. And doctor-patient communications knowledge we can receive you reading lecture, you reading special materials. In general, we discuss about some model. What does mean model of the communications? It's a style of communications. Mean patient has some role and doctor has some role. Yes. In general, now we discuss about a style of communications which use doctor. It's a doctor style of communications. Yes, of course. Doctor style of the communications influence to the patient's behavior. Yes, of course. Okay, it's a main like a classic style of the communications which use doctor in everyday practice. It's a paternalistic model. It's a informative models, interpretative models, and it's a person-focused model. Now we discuss about every model and discuss about positive and negative aspect of the every model. Paternalistic model. It's a classic model of the doctor-patient's relations. In these situations, a doctor like parents. What's important? Parents control child, but parents like child. Clear? Parents try to do everything do positive for child. It's very important. It's not a full control, no. It's full control with empathy. Dear colleagues, today I every time use terms empathy and sympathy. What does mean sympathy? You feel same emotions like a other person. For example, I have positive emotions, you have positive emotions. You feel like same emotions like I am. You understand? In sympathy, you feel same emotions like a other person. It's not so good in medicine. Why? Because usual patient suffering due some problems and usual patient has a negative mood. And as a result, if you feel a sympathy, you every time has negative moods and depression. In doctor-patient relations, you must use other type of communications with patients. It's named empathy. What does it mean, empathy? You show for patients via language, via face expressions, via body language, that you understand his emotions. You understand what's happy with him. You understand what he feel. You understand, but you not feel. Clear? Because you something inside from patients. Why you stand up like something side? Because you need help for patients. If you be cry with patients common, you cannot do anything. Clear? You must be a very cold mind, but you must show for patients that you has internal warm. Clear? You has warm in soul and you has a cold in mind. It's clear your target. And in this model, doctor like patient submissive behavior. It's like a parents which like when child do everything's correct. Why parents, father or mother like control child? Because mother and father think that do something very good for child. Clear? because child has less information about words, child has less life experience, child has don't understand what's happy around him. And yes, of course, doctor and parents do everything for take something positive for child, like doctor do everything like do something positive for patients, clear. But doctor want from the patient side submissive behavior, clear. It's very important. Yes, of course, this style of behavior sometimes patients don't like, because in up-to-date life everybody has a freedoms, everybody has enough informations, and everybody has own opinion about everything. And if you not explain why do something, patients be recognize this not so good. Patients very often don't like submissive style of behavior. In paternalistic model, doctor it's like an expert, and patient like accepted to cooperation with doctor. In this communication style, control patient's behavior, clear. In this style of behavior, I pay attention role of the patients, it's something submissive. He satisfied doctor recommendations, but very important, in this style, my opinion, patient must trust to doctor, patient must respect doctor. Some aspect of this model. This model very good in some situations, like in the psychiatric medicine, in the geriatric medicine, in pediatric medicine, in situations when patients has not enough experience or not enough or some cognitive problems. Yes, it's an autocratic model. It means that doctor centrate himself, like I know everything. In this model, we has main paradigm. Doctor know much more better than patients. And doctor, I repeat once more, in these situations, doctor control everything. Patients has submissive role. Patients has a good compliance, not adherence, compliance. Compliance, it's mean he only satisfy. He trust, but he maybe not understand what he do, clear. I mean, patient trust to doctor, but don't understand what's doctor do and why he do. Next model, informative model. In this model, doctor explain for patients why he must do something. Why he must do something. In these consultations, doctors must in these consultations, patients has some feelings that he has some level of autonomy, clear. Why? Because in these consultations, doctor control patients, but in previous model, doctor not explain information why he do something, and as a result, he developing increasing some level of anxiety. Because what has been anxiety? Anxiety, it's a something when it's a situations when we don't know what's happening in future. In these situations, we explain what's happening in future. In this model, we explain why patients do something. Yes, of course, we use a level of explanations materials like patients understand. We every time explain medical materials in the level of patients' educations. Very important feature. Never trust the patients if patients use a medical language. Clear? If patients use medical language, never trust to patients. Yes, of course, if paternalistic model, you use a same pattern of behavior in consultations. In this model, you must accommodate your behavior to the patient personality. Why? Because in this model, patient must understand your recommendations. You must do recommendations in a style in which patients understand. In this style of the consultations, sometimes we prepare for patients some way and patients do choice, clear. Like we can use this way in therapeutic or this way. What's way more suitable, clear. In this model, like a patient has some own decisions, but in frontiers which take a doctor for him, clear. Like we use some frontiers in which patients must in which patients has a freedoms, clear. It's not a full freedoms, it's a freedom in some frontiers. Deliberative model, a very interesting model. I like this model. Why? Because in this model, doctor like a friends or doctor like a counselor or counselor, clear. It's relations like a less formal level. In this model decrease patients' distress, but this model you need to create very close interpersonal contact with patients. You understand? In this model, you every time balancing between your friend, but your friend which has a more high qualifications, like your counselor, like your friends which are specialists in some area. And in this model, what positive in this model? In this model, positive because you reduce patients' distress. In this model, much more better provide discussions with patients. In this model, much more better use, for example, for long therapeutical process. Why? Because if patients has a high level of symptoms, patients has a high level of compliance. Because if patient has a pain, he do everything for reduce pain. If you use model, for example, if patient has a chronic diseases in which symptoms are not so expressive, in the situations treatment persists long time, treatment very body, result of the treatment not so understandable because it's persist very long time. And yes, of course, treatment very long. It's, I hope you understand why treatment very long. Yeah. And in these situations, my opinion, we must titrate dose of drugs. We very often change drugs because treatment very long. And this model, my opinion, very good for like these situations, because in this situation, when doctor and patients has a very good interpersonal relations, patients can contact with doctor if have some problems. It's a reduced shame feelings, hesitate feelings. It's very good for supportive, for maintenance treatment. For maintenance treatment, it's a treatment when symptoms absent, but we continue treatment, because if we stop treatment, symptoms come back. In general, very good techniques. I very often use these techniques in my practice, because my patients has not so strong symptoms, not so expressive symptoms, and length of treatment usual 1 year or something more, because psychiatric diseases, very often we use maintenance treatment. It's when patients absolutely has normal behavior, normal mental problems, but he continue use drugs, and we must explain why he must use drugs. Clear? Like your friend which has a more high level of educations. Yes, of course, we use a different approach of the different model of interactions between different patients in different situations, in different diseases. Clear? You like an actor, you must change your style of behavior in different situations. Yeah, for example, if you have met with a patient like a child, like old age patients, you must developing like paternalistic feelings in patients. Patients must trust to you, but patient's cognitive ability not enough for understand problems, what problems he has. And in these situations, he trusts to you. He do something because he trusts to you. Informative model. If patients, for example, has a high education level, yes, maybe patients has own opinion about everything. In these situations, much more better, and he not trust you. In these situations, you must every time show that you know much more information than this patients, and you explain every your step. For what purpose we do communications more close with patients? Because we need increase compliance. What does mean compliance? It's mean patients satisfy our recommendations. Our target is shift compliance to the adherence. Adherence, it's mean patients satisfy your recommendations because patients trust to you. Maybe recommendations not so pretty for patients, but we to do these recommendations because he trusts to you. Compliance, patients do recommendations because he patients you a doctor. And yes, of course, level of compliance depend present adherence or absent adherence. What factor influence to the communications between doctor and patients? What factors influence to the quality of communications? You understand, high quality communications reflect in the therapeutical compliance. If your communications with patients very high, patients satisfy your recommendations. Patients provide enough information for treatment. Okay. Main factors, it's a patient's related factors, doctor related factors, and interview setting. How to organize interview. Now we will describe these factors. First, factors which torture patients. It's physical symptoms. If patients has a very high expression of symptoms, if symptoms disturb patients, patients open for communications. Patients accept all communication style which you provide for him. Patient has a very high level of compliance. Patients do all recommendations because level of symptoms very high, and he ready do everything. He ready for living in some discomfort because level of symptoms take a more level decrease quality of life, take a discomfort, take a distress, take a stress for him. Clear? It's a physical factors. And remember rules: high pain, high compliance. High pain, high compliance. High symptoms, high compliance. It's rules. Psychological factors. It's the next groups of symptoms. Psychological factors. Yes, of course, it's a patient's parameter. Sometimes patients very friendly. Sometimes patients has some problems in personality characteristic, like a high or low level of agreeableness. Patient has a high level of non-conformism. What does mean non-conformism? He cannot change style of behavior. Yes, if he thinks something, he thinks that he is correct, and he every time support one strategy. Personality characteristic, yes, maybe personality problems like disorders of personality, it's very important. Level of educations, like a level of educations, if patients understand medical problems or not understand medical problems. And yes, of course, it's influenced to the style of communications. Clear. These factors, like you must analyze these factors and understand what style of communications patients must use. Clear. You must use with patients. Your current previous experience. It's very important. When you interact with patients, when you do interview with patients, patients very often be referenced to the previous doctor. Previous doctor said, and in these situations, it's very sensitive situations, because from first point of view, you must show respect to the previous doctor. Second, you must support own strategy in treatment. Clear. It's a balance. You show that previous doctor was very good. Everything's correct, but now we living in the current time. Those doctor in the former time, now we have new situations and new symptoms, new diseases maybe. Okay, previous experience. If previous doctor has conflict with patients, yes, of course, your communications has problems because patients don't trust to doctors. It's influenced to the previous experience. It's maybe not a clear communications between doctor and patients. It's maybe some articles in the social networks which patients reading about doctor, and as a result, now in society very often present negative informations like fog mist environment around doctor. Lot of negative informations about doctor, and patients coming to your consultations with negative previous experience. His experience negative, but he reading in articles a lot of things negative about medicine, and as a result, everything which you do in patient's mind, in patient's eyes, has negative aspect. How to struggle with previous experience, new positive experience. High level in communications ability. It's a very important step in doctor-patient's relations. Clear, very important state in the doctor-patient's relations. Like your current experience must be perfectly with patients. Yeah, if patients, but yes, of course, I repeat once more, previous experience very important, very important, and previous experience developing not only in the doctor office. This experience developing in the social network, in the mass media. Yes, of course, your current experience, it's very important. Maybe patients be trust only to you and not trust to other doctor because he has negative experience. How to do positive current experience? Increase own communicative ability. Now we will discuss about doctor related factors in the communications. First, it's training. You must visit a seminar, you must visit a practice, you must reading theoretical materials about communication skills. Communication skills, I pay your attention, it's not an art, it's a subject. You can learn communication skills. If you have internal problems in communications, you must visit a special class, special practice. Self-confidence ability in the communicate, it's very important. It's very important in communications between doctor and patients. It's important for both sides. Personality. It's your personality. I mean your factors. Clear? It's your factors. It's mean your type of personality. You remember type of personality. Your extroversions, introversions. You're open to the corporate job. Don't like corporate job. It's level of the conforming. Can you change style of the, if you has a high level of the non-conformings, you use every time one style of the communications, one communication style. It's not so good. You understand? You every time must change communication style. Every patient's unique, and every style of communications unique. Every case unique. It's I ask you, remember, and you must understand every communication style. Physical factors, yes, of course. I mean, doctor health. Doctor, it's a person. He has maybe some problems with health. It's very important. Psychological factors. Psychological factors, maybe previous experience about these patients. Yeah, it's maybe psychological factors like what's problems today with you. What's your relations with boss. What's level of your you like your job, you like your life, quality of life. It's very important factors which influence to you, to your communications with patients. Because I repeat once more, doctor-patient's relations, it's a communications of the two personality. It's a communications between two personality. Now we discuss about main feature of the interview setting. So first, privacy. A lot of questions. Shame. Take a shame for patients. Patients must feel a privacy in interview. Comfortable surrounding. It's mean good office. Temperature, light, cleaning. It's very important. An appropriate seating arrangement, very important to clear, like your appearance, furniture which in your office, like distance between you and patients. Lot of things which were influenced to the doctor-patient's relations. Now we discuss about two terms. In general, it's a psychoanalytic terms. I ask you, now you're reading definitions. Now I'm mute because you're reading definitions. You remember, transference and counter-transference, it's a theoretical background of the previous experience. Clear? You remember, previous experience, current experience. These two terms, it's like psychological rules. Clear? Now I show some psychological rules which every time present in our life. It's not only relations between doctor and patients. It's relations between teacher and students. It's relations between friends. It's very important rules. It's a psychoanalytic theory. I hope you understand these topics. Yeah. Now we discuss about type of communications in this grid. What shows this grid? For example, default communications. Patient has low interest into own health. Doctor has a low interest into the own occupations, to the result of own job. Why doctor has low level? For example, doctor tired. Doctor has some psychological problems. Doctor has problems in quality of life. Doctor has a negative previous experience, with these patients, maybe with patients in general. It's a lot of situations which influence to the this feature. Okay, now you understand. Low. It's mean low doctor, low patients, and relations like a default. Other situations. In general, now we explain how to choose communication style. For example, patient has a low level interest, low low patience. He has a low level interest to the own health, to the therapeutical process. But you very young doctor, you has a lot of interest in treatment. And yes, of course, you won't control patients. Patients, you every time patients, you must do these things, these things, those other things. You control everything, and patients have not interest in discussions. Patients like a lazy son. You do something, but you must every time control patient's behavior. Yeah. I pay attention. If patient has a high interest, this style of communications not so good, clear, because patients won't interact with you. In this, you must use different style. Sometimes when doctor low and patient high interest, doctor like a salesman in the shop without interest into the job, and patients prepare a lot of questions, and doctor like explain something only in situations if patient asks something. Now we describe effective doctor-patient communication psychological aspect. High level of the communications increase patient satisfaction. It means it take a positive emotions and do therapeutical process more easy. Positive impact on the patient's health outcomes. Yes, of course. We have rules. Then patients, good communications between patients and doctor increase control in the chronic diseases. Take like a placebo effect. Clear placebo effect. It's present, associated with decrease in the emotional distress in the patients. Yes, of course. Diseases take a distress. What does it mean, distress? Distress, it's a situations. It's a negative situations for somebody without positive exit. It means it's a long-term process. And when we discuss about reduced distress, it means that we show new aspect, new positive exit from the negative situations. Clear? Next. Better control of the patients with chronic disease, very important. It's a clinical aspect. It's mean yes, of course, clinical aspect and psychological aspect has very close relations. Complaints, its influence to the medical interventions. Why? Because if patients provide more complaints, if patients much more better, which patients describe often complaints, you take more, your diagnosis more correct, and as a result it's influence to the intervention, to the treatment process. Yes, of course, if the patients provide more information about himself, we do less diagnostic tests, because you remember that clinical interview, it's very important things. In clinical interview, we understand and take diagnosis without problems. Yes, of course, evidence-based medicine, it's very good, but sometimes we can take diagnosis in the early stage, and after that prescribe only test which need for evidence one diagnosis. It's a reduced price too. It's a reduced price. Yes, of course, reduce effective doctor-patient relations. Communications reduce medical costs due less tests, less drugs. Why less drugs? Because you have a good contact with patients and you can manage symptoms. Clear, you can manage symptoms, prescribe small dose, correct dose, because patients, you have a good feedback from patients and you yourself. In this picture, you see some skills which you need for communications, yes. Context of interview setting, using open and close questions, summary statement, normalized, reflective, yes, and emphatic statement, conclusion statement. It's like a stage of the clinical interview. I pay your attention. Clinical interview, style of the clinical interview, it's like a other aspect. This stage, same for different style of the doctor-patient relations. Clear? It's for different style, but you must pass all of this stage in interview. Now I show you example, yes, about communication skills. Now we show like introductions. You understand, we explain future. We explain for patients what's happy in next 6 weeks. Why we do these things? We do these things for reduce anxiety. Next picture. Now it's an example of the open questions. In open questions, we open we open way for patients explain open ideas. It's he can provide a lot of information which you not ask. Clear. For example, how are you? How are you? It's patients maybe explain about family, about himself, about diseases. And in open questions, you can receive a lot of information. But what problems in open questions? In open questions, you not control interview. Clear. You must very correctly break in patients which he provide information which not so interesting for the for diagnostic which not so interesting for interview. But you must do this very correctly, because open questions you need a very high experience in the interpersonal relations. Close questions, yes, no. Answer yes, no. These questions are very good for diagnostic, but these questions reduce distress in a patient's soul, because patients won't provide some information which important for him. Clear? We like provide information. We like speak with somebody, and this style of communication is very good for therapeutical, from therapeutical point of view, from medical point of view. But this style of questions not so good for improved communications between doctors and patients. Now example of the summary stations. Yes, it's like a doctor language. You like summarize what's happy and explain what's be in future, and you show decisions. Very important in these situations. You show some decisions what patient must do. Normalizing state. Yeah, I hope you understand from this language. Conclusion statement, like, yes. Okay, I hope you understand how to manage. Yeah. Okay, thank you very much for your attention. Thank you very much for your attendance. Professor Alexander Dvirsky provides this lecture for you. Goodbye. Dear colleagues, in the website present presentation of this lecture, I recommend reading these materials because it's a very important topic for you. It's influenced to because 50% in treatment process it's doctor-patient communications. For you, a lot of diseases without positive resultant treatment, and you must decrease distress, you must take satisfactions from communications between you and patients. Okay, for today enough. Goodbye.